Hi, I'm Dr. Paul Steenburg, and I'm a family practice physician, recently retired in Northeast Indiana. And I would like to share with you briefly, I just got back from exercising and walking our dogs, uh, about a program that I used in my practice that allowed me to get my patients healthier in a way that I never could before. My practice was basically prescriptive, and prescription drugs can be life-saving and certainly reduce suffering, and in some cases extend lifespan, but they never really got to the source of the problem in a lot of cases. And this program has allowed me to do that, and I really believe in the last 5 or 6 years I've helped more people get truly healthy than I had in the previous 3 decades of practice. One of my own patients introduced me to this program, and she was an overweight diabetic on expensive drugs, including Januvia, and she wanted to try this program, and she shared it with me to make sure it was safe. I looked at it, there are no drugs or anything else involved, and I told her I had no idea if it would work, but it looked safe and she would go ahead and try it. And she came back in 3 months later with her labs, and all of her abnormal labs had returned to normal. Her A1C and fasting blood sugar were normal, her cholesterol was fine, her blood pressure and weight were down, and I was able to get her off of all of her prescription drugs. I'd struggled with my own weight and health my entire adult life, and I should have known better as a physician because I have a strong family history of diabetes, heart disease, high cholesterol, and high blood pressure. And I was standing there 60 pounds overweight looking at her normal labs and hearing how she loved the program. So I tried it myself, and it was one of these of many programs I tried in the past, and I lost 60 pounds over 5 years ago, and I've kept it off, and I'm not afraid of gaining it back because this is not a diet but a true comprehensive lifestyle program. And it has 4 pillars that separate it from all the other programs out there. The name of the program is Optavia, which stands for the optimal way, and the 4 pillars are health coaching, habits of health lifestyle system, support with a Facebook page, and weekly live and recorded webinars that teach healthy lifestyle and rock solid nutrition. I'd like to address any skepticism healthcare providers may have, because we are skeptical by nature, and we should be, because you definitely don't want to introduce anything in our practice or share with our patients that is not backed by science. The parent company is called Medifast, and Medifast manufactures and distributes the program. They've been in business since 1980 and were founded by a medical doctor. It's traded on the New York Stock Exchange. For 2 years in a row, it was on the Forbes 100 most trusted businesses in America. It has an 8-member scientific advisory panel, and the chairman of that panel is Dr. Cheskins, who is the co-founder and medical director of the Johns Hopkins Weight Management Program. Our medical director of Optavia is Wayne Scott Anderson, who was the 10th board-certified physician in the country in critical care, graduated at the top of his medical school class, and he practiced critical care medicine in Grandview Hospital in Dayton, Ohio for 2 decades. He realized toward the end of his practice there that he was not really helping his patients get healthy. He was seeing them in his ICU and realized that they were there to a large extent, and in many cases because of their unhealthy lifestyle. He was basically stamping out fires, and it was a revolving door type of situation where the same patients were coming back because they didn't change their lifestyle and how they were living. He felt he was at the bottom of a cliff, kept catching his patients as they fell off, and he wanted to get at the top, catch them upstream, put up a fence or a barrier and get to them, stop them before their health deteriorated and they fell off the cliff. As far as I'm concerned, I have, as I mentioned, helped more people get healthy in the last few years than I had in my previous 3 decades of medical practice. And by that I mean truly healthy, getting them off of some prescription drugs. And this program works great for diabetics, high blood pressure and high cholesterol, and also inflammatory conditions. So this is a very brief overview, and if you would like more information to see if this might be a fit for what you're looking for in your medical practice, I'd be glad to talk to you. I chose myself to coach my patients because it integrated very smoothly into a busy practice and was introduced during routine office visits. And the program is basically self-directed by the patients, and we're the guide. Some offices and practices delegate a staff member to manage the program, but it doesn't really have to take much time since, as I said, it's self-directed. There are many different business models, how it can be introduced, whether you're self-employed or employed, and it may be a referral-based practice. That may be your choice or preference, and many physicians in our area have referred their patients to me because they have seen the amazing results, which are speaking for themselves. So anyhow, if you would like more information, I'd be glad to chat with you on the phone, meet you in person, or do a video chat where we can see each other. And you can learn about this and decide if it might be a fit for what you're looking for to help your patients get truly healthy with new tools you never learned about in medical school in a way that you never could have before. Thank you.